Fox 5 and Hot 97 present Street Soldiers with Lisa Evers.
Vaccine realities. Where can you get it? When can you get it? And should you even get it in the first place? You've got questions and we've got answers. An all-star panel gathered tonight for a Street Soldiers virtual town hall. The most brilliant scientific minds have come up with a vaccine they believe can save lives, but not everyone is in a rush to get it. For tonight's virtual town hall, we've gathered doctors and community leaders to bring you what you need to know. And coming up a little bit later, we'll be taking some questions from my followers on social media. But let's begin tonight with a closer look at how we got here.
Excited and relieved that there is some protection from this demonic COVID-19.
I just come down and they was taking it and I took it.
I feel very grateful that this combination has happened with Abyssinian and we're able to get this vaccine.
An enormous effort is underway to get millions of Americans vaccinated as quickly as possible. A CDC study finds Black and Latino Americans are 2 to 3 times more likely to die from COVID-19 than whites. Medical experts say one reason is systemic race-based health disparities that make communities of color more vulnerable. It's especially disturbing in light of new data from 16 states reported in Kaiser Health News. It found Black Americans are 2 to 3 times less likely to be vaccinated than whites. These are troubling statistics according to the panel of experts we've gathered for our virtual town hall.
Think about this. It's true. In our community, so little bit people distrust. In the 50, 60%, other white folk area, the 80% trust. We have to be the one telling them this is good.
There are no boundaries when it comes to this virus, so we need to make sure that everyone who is eligible to receive the vaccine obtains a vaccine.
Public health officials say some vaccine distrust is due to rumors. One is that the vaccine contains the coronavirus itself, so why put it in your body if you're not already sick?
Do we really know what's in that shot?
So we actually do. And so the current vaccines that are out there, and I think most people have heard, there's the Pfizer and the Moderna, and those are mRNA vaccines.
Dr. Aroko Maliz says it does not contain the virus itself, but acts as a messenger to the body's immune system to activate its defenses when the coronavirus is detected.
And then your body's immune system gets into action. It says, okay, we recognize something that's not normal here. So what we're going to do is we're going to send out our antibodies.
We begin our virtual town hall with a view from the streets.
We have joining us Dr. Ramon Talaj. He's the chairman of the board and founder of Somos Community Care, and he has been one of the pioneers leading the charge and leading the effort to bring the vaccine to the communities that have been most hard hit by the virus, have lost the most lives, namely the Black and Latino communities here in New York City and New York State. Also joining us is State Senator Brian Benjamin. He's a Democrat from Harlem. Also joining us is Danny Barber. He's a NYCHA resident himself and also president of CCOP. It's the Citywide Council of Presidents of NYCHA developments all around the city. Dr. Talaj, I want to start with you on this. Why are you so convinced that this vaccine is necessary to get us out of this pandemic?
Point very convinced, Lisa, because I call the vaccine of hope, la vacuna de la esperanza. It's going to finish with the virus or the solid virus. Is definitely what we were expecting to happen. Yes, it's true that it's being slow, but we have it. We have the vaccine. We have to be sure that we get more for our communities. That the vaccine it works. I already did it. I'm 65 2 days ago. Now we have to be sure that they come to our neighborhoods.
No, absolutely. Brian, in terms of some of the questions that you're getting from people when you talk about the vaccine, give us an idea of what you're hearing in your Harlem district from your constituents.
Sure. Thank you so much for that, Lisa. I'm hearing a number of things. One of the things I'm hearing is, can we trust the government? As many of us know, the Tuskegee experiment is still around in people's heads, where the U.S. government sanctioned some pretty bad stuff to Black men. And I think, it's our job, and that's why I'm glad we have these partnerships between groups like Somos and some trusted community groups like our churches, and working with some of our key tenant leaders, because we have to deal with that trust issue. And people are saying, well, you know what, Brian, I'll do it, but let me see what happens. Let me have other people take it first. I'm not so sure. Let me wait. Those are concerns that I got because people are scared. They don't know exactly what's in the vaccine. They're worried that they might have to get injected with COVID, like we do with the flu. So there's so much distrust and misinformation that one of the things that we've been trying to do in my office has been to educate people as to what is in the vaccine. But what we have to do, Lisa, is we have to deal with this government distrust issue. And that's what I've been working on. And that's why it's so important that we are actively in the church having conversations just like this to make sure people feel safe.
And we're going to get to what's in the vaccine with Dr. Talaj in just a moment, have it and break it down for us. Danny, but your feelings as a tenant leader, as a resident leader, and a leader in the community, speaking for the hundreds of thousands of NYCHA residents who oftentimes are voiceless and whose needs are often ignored. What are you hearing about the vaccine?
Well, similar to what Senator Benjamin said, it's the lack of trust. A lot of the senior residents are waiting for their primary care physicians to give them the okay to go forth and take it. There needs to be more education. I myself am skeptical on taking it.
Why?
But that won't, why? Because it hasn't, with all of the adversities with the swine flu, the Tuskegee experiment and everything, it took time to create vaccines and cures. This is something that happened rapidly, and then it's going out, and then to hear different adverse effects and how it's affecting people, it becomes an issue.
But you told me, despite the fact that you have reservations, you're still
Yes.
to get it for your seniors.
Yes, I will not stop the seniors or anyone else that wants to take the vaccine. That's my feeling. That should not hinder you or how you feel to stop you from doing what's best for you.
Dr. Talaj, this is the number one question that we've been getting from everybody, is people say, well, I'm not taking it because the coronavirus is in the vaccine, and if I don't have it already in my body, why should I put that in my body? What do you say to that?
What do you allow with this? What do you prefer? To get the vaccine or to get the disease, which is the whole virus coming to your body and could kill you? It has killed 500,000 of Americans almost there. You know, a lot of people with secondary effects with this virus, sequela, who are very difficult to understand, like my kids, one of my kids. No, it's better to have the vaccine.
And Brian, State Senator Brian Benjamin, Brian, you came from a background of community involvement, community activism, and how do you build that trust in the people? But I have to say, I saw what was going on at Abyssinian Baptist Church, the whole Somos Abyssinian partnership that was there. We talked to people who had appointments and were on the line, and they said, you know, at first I had reservations, but when I saw the church was okay with it, that gave them the credibility. So that direct community approach, that's a hallmark of Somos, one of their founding principles. How does that get you over the hump in terms of the community distrust, or how do you deal with that?
I think that helps without question. And that, you know, a number of folks were saying to me, oh, I'm going to Abyssinian to get my vaccine because they trust Abyssinian. I think it's helpful, though, to also try to educate people directly as well with some of their fears. And I think, you know, doctors mentioned some of these points. My argument, because people ask me, am I taking it? So let's start with that. I look forward to being able to take it. And I have a couple of quick reasons. One is, from my understanding, the mRNA vaccine does not include the coronavirus in it. It is a completely different sort of vaccine that's not like the flu. That's number one.
Hold on,
is that true?
Dr. Talaj, that's true. It does not have the coronavirus in it. Is that correct?
No, it is not. That's what I tried to say. This vaccine will mimic something that when it goes into your cell, instead of the whole virus attacking you, that piece goes to your cell, will create some things, and the messenger goes out and produce some kind of, they call antigen, and then our body starts producing something against that. And that will destroy the outside of the cell, the corona. This is why it's so effective.
Coronavirus is still aggressively ramping up on us now. I mean, we're still losing people to the coronavirus every single day. Over 50,000 African Americans have died. And, you know, I don't have a better alternative. I see a number of key leaders from all walks of life black, brown, yellow, pink, people, the president, the vice president, people, pastors, people in the community taking the coronavirus. We all will either live or die together with the coronavirus. So as far as I'm concerned, I look at this a little differently than some of the historical issues that we've had with distrust.
You're looking forward to the future. And Brian, let me ask Danny. One of the issues and one of the concerns has been elderly people. What kinds of issues are the seniors facing? Because I know you were trying to get the vaccine for some of your seniors as well.
Yeah, so it's funny that you say that, because calls are coming in from different organizations and agencies that want to provide the vaccine, the option to be able to take it to seniors that live in public housing specifically, to make sure that these communities get access to it. So I'll be reaching out to a lot of these groups to see who we can partner with to get them to go to the different boroughs, to the NYCHA developments, and take care of the senior population.
Our virtual town hall continues. Up next, our Frontline Hero makes a personal plea.
We need to educate ourselves. We need to make sure that we get the knowledge.
Plus, we're taking viewer questions from social media. A doctor will be here to get us some answers. We continue now with our town hall. Critical care nurse Arlene Ramirez is Director of Emergency Department Patient Care at Long Island Jewish Medical Center in Valley Stream. She's been on the front lines since the pandemic began, saving lives despite her own family tragedy. Her father passed away from COVID-19 before the vaccine was available. She joins me now to share her story.
Arlene, what has this whole period of the pandemic been like for you as the Director of Patient Care in an emergency room?
It's been very, very challenging. There are many components to my role that I have to, implement. That's support the staff, definitely be in the front lines with the staff, and as much as we can, educate all the people around us in regards to the vaccine, be a champion and a promoter of the vaccine so that we can come over this pandemic.
And then in terms of your personal experience, you lost your father to the virus, and my condolences to you and your family over that. What impact did that have on you? Because there you are on the front lines, you're a healthcare worker, you're dealing with sick people every day, and then to have it hit so close to home and to the man who basically gave you life, what did that do to you emotionally?
It definitely took a toll. It's been very difficult. I actually cannot believe that we're nearing, feels like yesterday. It took a toll both professionally and personally, too close to home, I would say. But yet I feel that it has empowered me to make sure that I get the message out there, the importance of, masking, social distancing, and the vaccine, now that we have something that can help us eradicate this disease, this virus.
Do you feel that if the vaccine had been available at the time your dad got sick, that he might have had a better chance at surviving?
Definitely. If we knew then what we know now, I have no doubt that my dad would probably be still with us.
And what do you say to people who have questions about, well, I don't want to take the vaccine because I don't know if it's safe. I don't know if it's really going to matter or really make a difference. I'm sure you hear that from people, and especially in our Black and Latino communities where there's still vaccine resistance, according to so many reports and studies. What do you say to those people?
We need to educate ourselves. We need to make sure that we get the knowledge and the information from good sources. I think that definitely we have room for health literacy, and there's a lot of mistrust, which is understood. Hence the reason why it's important that we make sure that we educate ourselves and that we use reliable sources to obtain information when making that decision, that important decision.
Up next, a doctor answers some of the questions you sent us through social media.
Joining me now is Dr. Tochi Iroku Maliz. She is the chair of family medicine at Northwell Health and also the Zucker School of Medicine. And she can give us a lot of answers to many of the questions that you've been asking me on the streets when you see me, on social media. and all over the place. I promised my followers that I would ask you some questions. So Mambar One is asking, after I get the vaccine, can I still spread COVID? What about that?
So that is an absolutely great question because we're not quite sure. And that's where the further studies are going. So that's why I said that getting the vaccine, you still have to use the other tools that we have in our toolbox. You still have to wear the facial mask. You still have to wash your hands. You still have to do social distancing. While they're doing further studies now to check those who have gotten the vaccine, there are some people that are going to be tested regularly to see whether or not they still, and when they have the COVID, when they are exposed to the coronavirus, whether or not they're transmitting it and how long that lasts. So no, do not stop using the other items to
safety measures.
And there's still that possibility that you may be able to spread it, which is why they are very, very strong in saying to you for now, after you get the vaccine, please continue to do all the other metrics. Because you have to keep everybody, you want to protect your family, you want to protect everyone around you until we get to the critical number where enough people are vaccinated and enough people are not hospitalized, right? Because that helps you as well, so that even if you do get it, that your body's supposed to be attacking it and keeping it to a low level, so that you don't get very sick, you don't get hospitalized, you don't get intubated, and that's very important.
And that's one of the goals. George Elizalde says he got the shot. He said it had me feeling beat up for the first few days. God bless me. Hopefully it helps. What can you tell George, and also what can you tell us in terms of the side effects after you get it?
So George, I'm sorry you went through that, but that is actually part of the side effects of the vaccine. So the first dose, you'll get, some people will get headaches, some people will get fever, some people may have a little bit of chills, muscle ache at the area where you got the shot. Your arm may feel really heavy. You'll have some pain. Some people have nothing at all, and some people it may last up to 7 days. And so that's something that everybody should know. It's that we are trying to be very transparent about that. It aches for some people. The second dose that you get, so if it's Pfizer, it's about 3 weeks later. If it's Moderna, it's 4 weeks later. Sometimes the reaction may be a little bit more, and I'm being very transparent, so I just want you to know. So take your acetaminophen if you need to bring down your fever if you have it, or to take care of the pain in that area. And, we try to say, if possible, try and get some rest afterwards. I've heard some people say that they just went to sleep and they slept for like 18 hours afterwards because their body, they were so tired. So it is normal.
I'll cover your body reaction. I know we have just a couple more minutes with you, but I want to get into more questions from our viewers and my Instagram followers. So VNC 1025 says, quote, still uncomfortable getting a vaccine. I know a few people who got it and got sick. You're saying you may feel some minor side effects.
You're going to feel a little sick, and that's your body, because your body's mounting. You remember the vaccine is
the defense.
Your body to create an immune response. So that's part of it. And so yes, but it's this. You'll be able to again, if you can get some rest, use acetaminophen. To be able to bring down that fever or to take care of the body aches, but you should still get it, because getting the disease would be worse than that minor
than those side effects. Okay, and then Mark Kristen Smith asked, does anyone know how long the vaccine lasts? So is it effective for years, or do we know? Or for 1 year, or what?
We absolutely do not know at this time. And that's why everyone has to be transparent about this. We're not sure how long the immunity will last. This is new to us, and that's why you have the long-term studies where over the year to year, 2 years, to see how long does this last. Do people get reinfected? Because if you get reinfected, that means, okay, the immunity has dropped. So we'll be watching and monitoring the people that have gotten the vaccine so that we can tell. We're not even sure 100% how long your immunity lasts after you've gotten ill from the vaccine and you built up natural antibodies. So this is all to be determined as time moves forward, but we'll be watching that closely.